Every year, people unknowingly screw up their Medicare coverage, and once they realize, it's oftentimes too late. But there are a few secrets that many people don't know about how and when you can change your Medicare plan. And I'm going to share all of this today. I'm going to share some semi-secret tips and tricks that aren't often talked about, so stay tuned. And when I talk about messing up your Medicare coverage, this can mean a lot of different things. Maybe you accidentally enrolled in the wrong plan for your needs, or maybe you didn't do anything. Maybe you should have changed your plan. So today I'm going to explain both situations. We'll talk about Medicare Part C, Medicare Advantage plans, how to make changes there, how to change or drop your Medicare Advantage plan, and also how to change your Medicare Part D prescription drug plan. Now, most people have heard of the Medicare Fall Open Enrollment Period. This runs from October 15th to December 7th every year, but far fewer people have heard about the Medicare Advantage Open Enrollment Period that happens in the first quarter of each calendar year. I'm also going to review Medicare Advantage Trial Rights, what those are, and I'm going to discuss a Medicare Special Enrollment Period that may allow you to make changes to your Medicare plan even if you missed that fall open enrollment window. My name is Stephanie Apt. I'm a licensed independent insurance agent. I have a team of licensed agents that work with me in my office, and we help seniors with their Medicare coverage nationwide. And if you find value in today's video, please like the video, subscribe to the channel if you haven't done so yet, and be sure to share this video with someone who may find this information useful. Now, the first kind of hidden enrollment period that I want to talk about is the Medicare Advantage Open Enrollment Period. This period is from January 1st to March 31st every calendar year. And during this time, anyone on a Medicare Advantage plan can make one plan change. So they can either choose to enroll in a new, different Medicare Advantage plan during this time, or they can choose to drop their Medicare Advantage plan, return to traditional Medicare, and enroll in a standalone Part D prescription drug plan if they'd like to during this window. This period is only for people who are currently on a Medicare Advantage plan and want to make a plan change. This is not for people who forgot to make a Part D prescription drug plan change during the fall. This is only for Medicare Advantage plan enrollees. Now, if you're watching this video and you don't understand exactly what a Medicare Advantage plan is or how it works, or the difference between a Medicare Advantage plan and a Medicare Supplement plan, then I'm going to suggest you go back and watch this video that I've linked in the show notes below. In today's video, I won't really be explaining the coverage differences between Medicare Advantage and Medicare Supplement, so be sure to backtrack and watch that one if you need a refresher. So let's say that you are enrolled in a Medicare Advantage plan. You can choose a new and different Medicare Advantage plan during the Medicare Advantage open enrollment window between January 1st and March 31st every year, and any change you make will go into effect the first day of the next month. Now, let's say you want off Medicare Advantage altogether. Then you can choose to drop your Advantage coverage between January 1st and March 31st. Now, how do you do this? Well, it's simple. You simply enroll in a standalone Part D prescription drug plan. See, Medicare only gives you one slot that you can use for either a Part D prescription drug plan with traditional Medicare or a Medicare Part C Medicare Advantage plan. And when you enroll in one, it automatically cancels out the other coverage. You can't have both. So when you go and enroll in a standalone Part D prescription drug plan, it will automatically cancel your Medicare Advantage coverage effective the first day of the next month. If you were applying online, then you would choose this specific election if you are enrolling in a Part D prescription drug plan during the Medicare Advantage open enrollment period. But, and this is a big but, it's important to know that if you do this, then you will be kicked back to traditional Medicare Parts A and B, and traditional Medicare doesn't cover everything at 100%. You are responsible for several different deductibles, copays, and coinsurance amounts, and on average, traditional Medicare pays about 80% of your medical coverage, and you're responsible for the other 20%. So if you have a major hospitalization, or God forbid you get cancer, 20% of the cost of cancer treatments can be an astronomical amount. So most most people on traditional Medicare will want a Medigap, also known as a Medicare supplement plan. Those two words mean the same thing, to help pay that 20% that traditional Medicare doesn't pay. There are several different types of Medigap plans. I go into more depth about the best Medicare supplement plans, which ones are the most popular, how these plans work in this video that's linked in the show notes below. What's important to know for today's purposes is that in most states, most people only get one opportunity to get a Medicare supplement plan without medical underwriting. Now, what is medical underwriting? In most states, Medicare supplement plans are medically underwritten. This means that the insurance company can ask you a series of health questions on your application. They look at your health history, they look at your current medications, and then they decide whether or not to approve your application for coverage. So based on your health, you could be denied or you could be rated at a much higher rate. Now, even though the Affordable Care Act did away with pre-existing condition exclusions for people under 65 on ACA Affordable Care Act health plans, it did not impact Medicare and Medicare supplement plans. So these plans can still ask you about your pre-existing conditions and deny you because of them. Now, there are a few states, the ones you see listed here, that are exceptions to this rule that never ask you any medical questions if you're applying for Medicare supplement insurance, but in most states, that's how it works. But no matter where you live or how sick or healthy you are, everyone on Medicare does get one chance to purchase a Medicare supplement plan without any health questions. And this is when you are turning 65 or you're brand new to Medicare Part B. You get a one-time 6-month window that you can choose any Medicare supplement plan that you want, and you will automatically be approved. And just to reassure you, once you are enrolled in and accepted for a Medicare supplement plan, the plan is guaranteed renewable for life. That means they can never cancel your plan or kick you off later or raise your rates because of your health. So I bring this up because if you are on a Medicare Advantage plan and you're looking to drop your coverage and go back to traditional Medicare and add a Medicare supplement plan to help pay that 20%, you should consider whether or not you can medically qualify for a Medicare supplement plan first. So what I recommend here in my office is look at the different insurance companies that are available to you and would be the best fit for you based on your health. We walk you through that medical underwriting process. And then if and only if and when you are accepted for the Medicare supplement coverage, would you then enroll in your standalone Medicare Part D prescription drug plan, which would then kick you off and cancel your Medicare Advantage coverage the first day of the next month. That way you are assured that you have full medical coverage in place before you cancel any coverage that you currently have. I want to talk a little bit more about guaranteed issue rights, what these are, and I want to mention a specific guaranteed issue right, which is called trial right, which can be a secret out for people that have a Medicare Advantage plan that they feel like they messed up and they now want out of. Guaranteed issue rights are special situations in which an insurance company must approve your application for coverage for Medicare supplement insurance, regardless of your health, regardless of how long you've been on Medicare Parts A and B. Some examples of guaranteed issue rights are losing employer-based or retiree health coverage, moving out of your Medicare Advantage plan service area if you have an Advantage plan, and another type of guaranteed issue right is called trial right. The first type of trial right number 1, is for people that joined a Medicare Advantage plan when they were first eligible for Medicare. And now within the first year of joining their Advantage plan, they decide that they want off and they want to go back to traditional Medicare. To qualify for this type of trial right, you typically must have had the same effective date for Medicare Part A, Part B, and your Advantage plan, all when you were first eligible for Medicare. And if you qualify, then you can come off of your Advantage plan at any time during those first 12 months, and you have the guaranteed issue right to choose any Medicare supplement plan that is available and offered in your state. You have up to 63 days to enroll in the Medicare supplement plan after your Advantage plan coverage ends. And again, you have to do this within the first 12 months of having a Medicare Advantage plan. The second type of trial right is for people that had a Medigap plan And then for the first time ever, they decided to enroll in a Medicare Advantage plan. If they've been on this plan for less than a year and they want to switch back to their old Medicare supplement plan, then they have a guaranteed issue right to do just that within the first 12 months. And you must return back to your same old Medicare supplement plan. So if you had a Blue Cross Blue Shield Plan G and then you dropped it to get a Medicare Advantage plan for the first time, you have 12 months to drop your Advantage plan and return back to that Blue Cross Blue Shield Plan G. Now, if for some reason Blue Cross Blue Shield no longer offered Plan G in your area, then you would have a guaranteed issue right to choose a different Plan G with a different insurance company offered in your area. Now, this trial right, it's kind of a cushion put into place where you can try a Medicare Advantage plan one time risk-free and return back to your old Medicare supplement plan. But keep in mind, you only get one chance to use this trial right. So it has to be the first time you've ever tried a Medicare Advantage plan. If you had a Medicare Advantage plan in the past, then you can't use this trial right. It has to be the first time you've tried Medicare Advantage. Now, lastly, I want to mention special enrollment periods for people who are looking to change their plan outside of the fall open enrollment window. Now, what I'll mention here is that with all of the crazy weather events that are happening all around the country right now and recently, many people are actually eligible for weather-related special enrollment periods, depending on where you live. So if you live in an area that was impacted by a recent weather disaster and you were unable to make a plan change to your Medicare plan during a recent enrollment period, then you may be eligible for a weather-related special enrollment window to make a plan change, even if you think you missed the deadline. So it can't hurt to see if you qualify for a weather-related special enrollment period. If this sounds like you, you can contact 1-800-Medicare. You can also check the FEMA website to see if you're in an area that was impacted by a recent weather disaster. So this is definitely something to consider if you live in an area that was impacted by major weather-related issues and you were unable to make a plan change during a recent enrollment period. Now, I also want to mention one last thing. If you have a Medigap Medicare supplement plan and you want to change to a different or lower cost Medicare supplement plan, there is no annual open enrollment period to do this. You can do it 365 days a year. Now, in most states, medical underwriting will apply, as we've already reviewed, but in some states, you actually get a birthday rule or an anniversary rule that allows you to change to a different Medicare supplement plan without any medical underwriting once a year. And I've linked a video in the show notes below that talks about all of the state-specific Medicare supplement rules so you can see if you qualify. And overall, I hope this video helped to review what to do if you think that you messed up your Medicare coverage. Thank you again so much for watching. Please leave any questions and comments for me below. I try to answer as many of them as I can. Thanks for being here. We'll see you soon.